Goeienaand, baie welkom by Fokus op die laaste Woensdag van April. Ek is Puren. Bietjie later in die program besoek ons Lily-myn in Mpumalanga, waar die families van 3 mynwerkers wat jarelangs ondergronds begrawe is, steeds hoop dat hulle lyke herwin sal word. Suid-Afrika se inentingsveldtog teen COVID-19 is vandag hervat. Die toediening van die Johnson & Johnson entstof is onlangs tydelik opgeskort nadat 6 mense in die VSA bloedklonte ontwikkel het nadat hulle die entstof ontvang het. Maar hoe veilig is die entstof? Ons praat nou via Zoom met Professor Adrian Puren van die Instituut vir Oordraagbare Siektes. And thank you so much for joining us this evening, Professor Puren. Just remind us again what the considerations were when South Africa decided to halt the use of Johnson & Johnson vaccine.
Thank you, and evening, Lynette, and your viewers. So as you know, we have gone through vaccine trials, and those are so-called phase 3 trials, and they enroll a certain number of individuals into the trial. They make them as large as possible. But you won't always see all the side effects of the vaccines or medications looking at those particular numbers. It's only really when you start rolling out in terms of a public health intervention like the vaccines that you then come across the so-called rare events. And that's what's actually happened here with the Johnson & Johnson vaccine in the United States. And similarly, in the United Kingdom and in Europe, they've noticed a small number of individuals in terms of the millions of people that have received the vaccine that presented with what we call thromboembolic thrombocytopenia. This is really the development of blood clots and the reduction in what we call platelets. And this is a rare phenomenon. The incidence or the rate was at least about 4 to 7 per million individuals. And once that was observed in those individuals, the FDA and the CDC decided to put the rollout of that particular vaccine, at least the Johnson & Johnson, on a pause in order to really try and understand what they are observing and what the implications were for rolling out the vaccine. They decided, based on the low probability of individuals aged between 15 to 49, that in fact the vaccine, and especially in females, the vaccine was essentially safe to roll out.
So what did we do in the interim? Were we waiting on the USA to give clarity on what the situation was and share their findings?
Yes, that is correct. So as you know, the Zonke vaccine rollout in South Africa is a part of a so-called 3B clinical trial. So it was really critical then for them to say, well, have we observed any of these cases? Did we miss any of them? Let's look at our data as well and inform any decision. So that was the decision made by SAPRA in consultation with the National Department of Health and the Medical Research Council to actually pause, look at their data, look at the data and the comments from the United States and make a decision around that. And I think based on the fact that I know that we've only vaccinated, I think, about under 300,000 individuals, but given that those numbers, no individuals presented with the signs and symptoms of clots within the space of 3 weeks post-vaccination. And given the comments from the CDC and the FDA, it was decided then to uplift that pause and to start the vaccination program today.
Is it too early to say definite or share definite conclusions about the efficacy of Johnson & Johnson at this point in time?
No, the efficacy of the vaccine has remained the same. In other words, it has, like the other vaccines, shown to be efficacious. As you know, the WHO had set a parameter of 50% efficacy for all vaccines. And so the Johnson & Johnson remains an efficacious, effective, and safe vaccine. It does have this rare phenomenon that is observed in younger women. However, it is not a cause for not rolling out the vaccine program.
For someone, and particularly in South Africa, those who have now registered to receive the vaccine, those who are over 60 and health workers that have to register, again, just to say that they are willing to continue with receiving that, what is the kind of protection and concerns that they should consider firstly, and that is provided after that very first shot?
Yes, so in any of those age groups, and as you quite rightly say, that the age group that's going to be vaccinated is above 60, so there the risk is even less so, in other words. However, they could keep an eye out within the first 3 weeks of particular signs and symptoms, such as the development of severe headache, difficulty in breathing, abdominal pain, and leg pain. These are signs of possible thromboembolic phenomenon. But again, as I said, in that particular age group, it's going to be fairly small compared to the younger age group up to the age of about 49 to 50. I think you also need to put this in context. So if you look at that phenomenon and the risk, it's about 0.0004%, so 3 zeros and then a 4% of developing that particular complication. However, if you were in that age category and above that age category, not receiving the vaccine puts you at higher risk of infection. And in fact, thromboembolic phenomenon in critically ill patients goes up to 16%. So if you can put those things and weigh up your risks, you could see that it is probably preferable to take the vaccine knowing that it will protect you and prevent severe disease, as well as preventing further transmission. So there are really good reasons why we should be encouraging and encouraged to continue to have access to the vaccine, and not only the Johnson & Johnson, but all other vaccines that do become available.
I'm so glad that you touch on the risk, because there's various opinions about whether people want to get the vaccine or not. But there are concerns if you have a history of blood clotting, for example, and this was the cause of why the US and we paused our use of it. What should you know if you have a history of blood clotting? How do you approach this then?
Yeah, so again, I'm hoping that the numbers of people that are on so-called blood thinners, and especially heparin, are not that major a group. However, if they are, then certainly they should discuss that with their medical provider in order to perhaps consider whether or not they should look for antibodies against platelet factor 4. But again, we've had no specific advice around that particular, but it is a consideration. So again, the clinician should be aware and have that discussion with his particular patient in order to decide whether or not, under those circumstances, either to change the blood thinner or to look at an alternative. As you know, we're also going to have the Pfizer vaccine.
Yes.
And so that may be an alternative to use as well. I think, in the United States, it was really different. The pause for the Johnson & Johnson didn't affect the rollout of the Pfizer. And we're going to be in that similar scenario, I hope, by the 17th of May, that we have some options around those rare events and events where we need to say, okay, you're on heparin, perhaps we will consider to use the Pfizer under those particular circumstances.
In conclusion, Professor Puren, what should we be aware of, and what's the lesson we can take from the escalation of infections in India and in Brazil? Because our winter is coming and there's been a lot of talk about this third wave. What should we know? How do we prepare?
Absolutely. So we're all aware that we came through a very huge peak, a second wave in South Africa, during the summer season. So going into winter, where people are going to be in greater contact with each other, there may be greater mobility. I think it's really critical, and the Departments of Health at national and provincial know that they should be preparing and have plans in place to make sure that the hospitals are ready in case there is a larger third wave. But it's also incumbent upon us as individuals. Again, we should be encouraged to make use of the fact that there is a vaccine. So those in those vulnerable age categories, I really would like to encourage you to access the vaccine. I know it may take time, but really you should. The healthcare workers as well, you should also make use of the fact that there's a vaccine specifically geared to protect the healthcare workers. If you are in the age risk categories, or if you're pregnant, for example, hypertensive, have cardiac disease, please ensure that you can gain access to the flu vaccine. Then coming back to the non-pharmaceutical interventions, those are also really critical while we roll out the vaccine. So the wearing of masks and wearing them properly, the physical hand hygiene, the physical distancing, ventilation, avoiding closed spaces, close contact. These are the key things that we should do in order to try and minimize the fact that there may be a third wave.
Thank you so much for your time this evening, Professor Puren. We appreciate that informative discussion. Net hierna maak ons 'n draai in Mpumalanga, waar die families van 3 vermiste mynwerkers steeds hoop dat hulle liggame herwin sal word. Moenie weggaan nie, ons is nou terug. Die families van die 3 mynwerkers wat vir die afgelope 5 jaar ondergronds by die Lily-myn in Mpumalanga begrawe is, sê hulle sal enige iets doen, selfs sterf, om hulle geliefdes terug te kry. Die tragedie het in Februarie 2016 plaasgevind, toe 'n deel van die Lily-myn meegegee en 3 mynwerkers ondergronds begrawe is. Die families van die oorledenes soek egter antwoorde oor die herwinningsproses en het 4 jaar gelede tente opgeslaan naby die ingang van die skag. Hulle trotseer nie net die genadeloose elemente van die natuur nie, maar ook gewelddadige aanvalle en dreigemente deur die nabye gemeenskap en onwettige mynwerkers. Fokusregisseur Wania van der Juffer en kameraman Sebusiso Matibula het ondersoek gaan instel.
Die families van die 3 mynwerkers, wie se lyke vir die afgelope 5 jaar sowat 60 meter by die Lily-myn in Mpumalanga ondergrond vasgekeer is, sê hulle sal voor die mynkamp, al beteken dit hulle moet gewelddadige aanvalle trotseer. Die bedroefde families van die 3 oorlede mynwerkers, Pratim Kabule, Solomon Yarenda en Ivan Menisi, is reeds 4 keer deur lede van die Louisville gemeenskap naby die myn aangeval. Lede van die gemeenskap het onlangs die familie se kamp vernietig en hulle tente aan die brand gesteek. Hulle word ook gereeld deur onwettige mynwerkers met geweld gedreig. Die moeders van die 3 mynwerkers sê egter, hulle is bereid om te sterf, maar sal nie die myn sonder hulle geliefdes verlaat nie. Selfs Fokus is nie deur die gemeenskap gespaar nie.
Enkele meter van waar ons nou staan, het die Louisville gemeenskap in Mpumalanga vir ons ingewag en met geweld gedreig. Toe ons hulle vra hoekom hulle so vyandig is, moes ons vlug. Die polisie het later vir ons gewaarsku om weens veiligheidsredes nie weer in die gebied te kom nie.
Op die 5de Februarie 2016 het die Lily-myn in Mpumalanga ineengestort en 90 mynwerkers ondergrond vasgekeer. 87 mynwerkers was gered, maar Pretty, Ivan en Solomon was nie so gelukkig nie. Die vragskiephouer waarin hulle was, het sowat 60 meter in 'n sinkgat verdwyn. Die pogings om hulle oorskot te herwin is weens veiligheidsredes afgelas. Die bedroefde families het 2 jaar gelede besluit om naby die ingang van die myn te kamp om antwoorde oor die herwinningsproses te kry. Die familie sê hulle stel nie aan geld belang nie. Hulle wil net hulle geliefdes ordentlik te ruste lê. Harry Mazibuko, die familie se woordvoerder, sê die skuldigdes wat die brand by die kamp gestig het, is misdadige elemente van die nabye gemeenskap en het geen rede om so op te tree nie.
I find it very difficult to understand in that aspect because I've got thousands of questions without a single answer.
You say that this is not the first time that your campsite has been destroyed and targeted by the community. Can you elaborate on that? When else did this occur?
Yes, it's the 4th time. Unfortunately, I can't recall the dates because I'm not in a good state of mind. But it happened, it's for the 4th time. The very same people, they are known to us. The cops, they've got a list of those people, but we've been opening cases, we've been reporting this. First of all, it was our tents were set alight during the night. It was after 1 o'clock, early in the morning. So we managed to extinguish that fire. Secondly, we were attacked by a bomb. So we survived again. I don't know how. We reported, we've opened the case, the bomb squad came here. There's no feedback, there's no report. The 3rd one, we were attacked with gunshots. It was again after 1 o'clock. So this is for the 4th time by the very same known individuals to us and our police officials.
Harry meen ten spyte van die aanvalle, kry hulle ondersteuning van 'n groter deel van die gemeenskap.
If we can percentagize it, these people who are doing these horrible acts, they are less than 20% in the total number of the community. They are doing it for that reason that they are getting paid. You see, everybody likes to have money in various ways, illegal and legal ways. So these ones, they've opted to do that. But the entire community, including the owner of the land, the chief, who is also a traditional leader, that is why we're having a meeting with him, the owner of the land. They are behind us because there's nothing wrong for us to seek intervention, to seek assistance without hurting anybody.
Rose Mkabi, Ivan se ma, weier om die Lily-myn sonder haar dogter te verlaat.
La angeke ngisuke. Noma bangaphinza bakuyenda lokho bakwenda itolo, angeke ngisuke ngakamtholi umbanami. Ngihlalele yena la. Ngamala ngife, ngifele la. Government nelive lonke litokwathi ukuthi thina sibadala sifele kulandza abantu bethu, sibulawele liqiniso ukuthi sifune abantu bethu. Asinzawu la.
Bly ingeskakel net hierna hoor ons wat die familie se regsverteenwoordiger die polisie oor die saak te sê het. Ons is nou terug. Welkom terug by Fokus. Vanaand ondersoek ons die gewelddadige aanvalle op die families van die 3 oorlede mynwerkers wat vir die afgelope 5 jaar ondergronds begrawe is in die Lily-myn in Mpumalanga. Die families wat sowat 1 kilometer van die myn se ingang woon, het sedert 2017 4 gewelddadige aanvalle oorleef. Hier is deel 2 van Wanie van die Juffer se verslag.
Wendell Bloem, die 3 families se regsverteenwoordiger, sê die kwaaddoeners is 'n groep mense wat glo die families kry vergoeding om by die myn te bly.
These people are simply there camping in order to see justice, but nonetheless they are attacked, it seems by their own for no reason. And it is something that is being addressed currently.
Wendell sê onwettige myners tuister ook gereeld die bedroefde families.
There's been a whole bunch of incidents where we had to engage the South African Police Service in attending at the mine to stop any imminent attacks from this group as well, over and above the threat posed by what it seems to be fellow employees who have disgruntlement and, in our view, unjustified disgruntlement.
Wendell, jy weet, dink jy die gesloer in die hofgeding van die kwotasies en beleggers lewer 'n bydrae tot die veiligheidsrisiko van die mense wat of die gesinne wat in die kamp woon?
No, most definitely, because the latest thing that is happening at the mine is that there are rumors that certain sections of the employees, which includes our clients, are causing the processes to be delayed, and it's all just unfounded and it's baseless. And but the current litigation is adding to primary disgruntlement amongst employees and amongst families, because it seems to them on a level that there is no finality being achieved in these matters.
Kolonel Donald Mtluli, die polisiewoordvoerder vir die Mpumalanga provinsie, het die voorvalle bevestig.
On Thursday, 8 April 2021, police were informed about an incident in which a tent belonging to the families of victims that were trapped at Lily-myn. Upon arrival, police opened an inquiry following the victims' reluctancy to open a case at that stage, where they cited that they first wanted to consult their legal representatives, of which is fine. Then later in the evening, they came to the police station where a case was opened with 2 counts, arson as well as theft.
Lomvimbi Mavuso, Pretty se ma, sê die gemeenskap sal hulle nie afskrik nie.
Bathi sisuke la sihlelileni la. Thina la sihlalele ukuthi basikhiphele labantwana lebalapha emgodini. Ngoba labantwana bebede bebasebenda, bebangedi kutontshontsha. Bede eksene emsebenzini, bangasabuyeli emakhaya. Bahamba kube thini namhla 5 years.
Lomwimbi meen hulle soek nie moeilikheid nie, maar wil graag die hele gemeenskap se ondersteuning hê.
Mina umphakathi ngawutshela nje ukuthi inkosi yami awusincede lokuthi awume nathi baze basikhiphele labantwana lapha.
Fiona Nyarenda sê sy glo haar kind lewe nog, hoewel die tragedie 5 jaar gelede gebeur het.
Hope yami ikhona kuJehova ukuthi ngaso sonke isikhathi ukuthi uthi manje noma ngabe kusho ukuthi lokhu lokukhulumako uyakudala.
Fiona meen daar is geen bewyse dat die 3 mynwerkers omgekom het nie.
Ngiyakholwa mina ukuthi bantwa bethu bayaphila ngoba ngani ngisho njalo ngisho ngoba mina kube bashonile ngabe sikhishele bona kudzala sabona ukuthi wona babashonile manje ke so ke ngokukholwa kwami ngiyakholwa ukuthi bantwa bami ngidawuphinze ngibabone and then lithemba lami lihlala likhona njalo kuJehova.
Dis ongelukkig aan vir vanaand. Onthou Fokus word elke donderdagoggend om 10:30 op SABC2 herhaal en ons is ook steeds beskikbaar op YouTube. Indien jy met ons kontak wil maak, besoek ons Facebookblad of jy kan vir ons e-pos stuur. Ons lees graag jou kommentaar, jou tweets en jou voorstelle. Maklik genoeg, stuur dit aan fokus@sabc.co.za. Bly op hoogte van al ons stories op ons Fokusblad op Facebook by Fokus SABC en dan volg jy ons ook op Twitter by Fokus ZA om te weet waaroor ons praat en wat ons beplan. Tot volgende Woensdag aand dan, bly veilig, sien jou dan. Totsiens.